Hello, good afternoon, ladies and gentlemen. Thank you very much for making time to be with us on this webinar today. I would like to introduce myself. My name is Kyeretwie Osei. I am the head of programs for the African Union Economic, Social, and Cultural Council. We are co-producing this webinar series together with the African Development Bank through their division on civil society. And we would like to welcome you to this webinar. To give you a very quick background of what we are trying to achieve with this webinar. As you know, we are now in the middle of the coronavirus pandemic. And as the bridge to the civil society, both on the side of the African Union through ECOSOC and also through our colleagues at the AFDB, we have decided to run these webinars in order to provide information and guidance to the African citizenry through the networks that we have. And so each week we focus on a topic of importance that will allow the African people who are affiliated with our two institutions to receive the relevant and verified information through the authoritative sources, particularly from Africa CDC and other sources as well. So today's webinar is going to focus on resource mobilization for CSOs who are fighting this pandemic. We think this topic is quite important because as we have seen, a lot of the responses that we have observed from the member states are flowing through the governments. They are either originating from the member states themselves or through international partners, but being disseminated through member state structures. So the purpose of this webinar today is to look at the potential role for civil society within this context. Are there opportunities for civil society to access resources in order to develop and implement responses against this pandemic? Are there any facilities that are available that perhaps civil society who have the relevant qualifications and capacity can access in order to bring the work of the member states down to the level of the people? And so this will be the main topic that our speakers will speak to us about today. We will have two speakers today. We have been very, very privileged today to have the Africa CDC represented at a very high level. So we have Dr. Ahmed Ouma, who is the Deputy Director of the Africa CDC. Dr. Ouma will speak to us on this topic. And it's good that he will be able to bring the institutional context in terms of how we are organizing ourselves as a continental body in order to raise resources to fight this pandemic. And then Dr. Ouma's presentation will be complemented by a presentation from a civil society representative as well, Dr. Ahmed Chehbouni, who is the president of the Centre de Développement de la Région de Tensif, which is based in Marrakech, Morocco. Dr. Chehbouni, on his part, will also share his experiences as a CSO in terms of accessing resources to implement activities within the context of the fight against the pandemic. In terms of the organization of the webinar, what we do usually and what we'll do today as well is we will have the speakers speak one after the other. Each presentation will be for 10 minutes. We will not stop after each presentation to have Q&A. We'll have the two presentations together. And then we will invite we will start the Q&A at that point. I would invite you to write your questions directly into the chat function, into the messaging function on Zoom. So there is a space for Q&A. Please write your questions there. I would ask you to please indicate to whom you would like to address your questions. So we have Dr. Ouma from CDC and Dr. Chehbouni. So it would be helpful for us for you to indicate to which speaker you're addressing your question. And in terms of social media, we are highlighting both of our respective social media handles. So for the AFDB group, is at AFDB_group, at AFDB_group. And for ECOSOC is at AECOSOC, at AECOSOC. And the hashtag that we are using for this series is hashtag Africa CSO response, hashtag Africa CSO response. So if you're doing any social media during the course of this webinar, please remember to utilize that hashtag. So with that said, we will go directly into the presentation so that we can maximize our time with our presenters. I'm now very privileged to invite the first presentation from Dr. Ahmed Ouma, Deputy Director, Africa Centers for Disease Control and Prevention. Dr. Ouma, you have the floor, sir.
Thank you very much for inviting me. It's a pleasure to be here and speak with colleagues from around Africa and indeed around the world. Just to say that due to connectivity issues, I will put the video off so that we have a smooth delivery of the message for today. So as introduced, my name is Dr. Ahmed Ogwell Ouma, and I'm Deputy Director at Africa CDC. I would like to start by just giving a quick overview of where we are in Africa today in as far as COVID-19 is concerned.
Okay, Ouma, just 1 second before you go into that, I'm sorry. I just wanted to invite participants to please select the language of their choice. I just wanted to bring to the attention of everyone. We have interpretation for today's webinar. So on your computer, you will see a symbol for interpretation. If you click on it, you can select English or French so that you can follow the presentation in the language of your preference. Again, I'm sorry for the interruption. Dr. Ouma, please go ahead.
Thank you very much. That is fine. People must understand each other. So in terms of the situation of COVID-19 on the continent, Africa has 55 member states. And as of this morning, we are updating the data as we go on. But as of this morning at about 10 o'clock, we had over 18,000, actually 18,333 cases that had been documented in 52 of our 55 member states. The good news is that we have, as of this morning, over 4,350 recoveries. These are individuals who have been confirmed to have had COVID-19 but have recovered. So the message here is that when you get it, you can recover. And unfortunately, we had recorded 960 deaths as of this morning. When we look at the evolution of COVID-19 since the first case was reported on the African continent on February 14, we see that it started off, the numbers were relatively small. By the time we were reaching the beginning of March, the numbers had started to expand. And in fact, from the beginning of March to date, we are almost in the middle of April, every 10 days or so, we are seeing the numbers double. This is not good because it means that we are seeing a trend that is becoming quite similar to where China, Europe, and indeed North America are. And it tells us that we need to do more in as far as interventions are concerned. So that is the situation in Africa today. To shift a bit to the interventions that we are seeing happening on the continent, Many countries, in fact, as of yesterday evening, we had 43 countries in Africa that had instituted lockdowns by closing off their borders completely. There will be no entry or exit except for goods. But human beings, there will be no entry or exit. This is really one of those measures that many countries have put in place to try and limit importation of COVID-19. And it is probably one of the most visible, because wherever you are now in Africa, indeed the world, chances are you are under, you are in the comfort of your home, not being able to go out unless for essential items. This is one of the measures that at Africa CDC we are encouraging individuals to take: social distancing, being in a situation where you are not too close to the next person, and in this way we are limiting a transmission of the virus from one person to the other. Now let me shift to the structure of response that we are seeing on the continent. When the first case was reported in February, the Africa Union, through the Africa CDC, called an emergency meeting of health ministers of the 55 member states. We held that meeting on February 22nd, and at that meeting, the ministers approved an Africa joint continental strategy for COVID-19 outbreak. And this strategy is the basis on which we at Africa CDC and Africa Union are providing support to our member states on the continent. The strategy has 6 main pillars, all of which are relatively technical, but I'll quickly explain them. The first pillar is laboratory systems. This is where we have been strengthening the capacity of member states to be able to do laboratory diagnosis and confirmation of COVID-19. When this outbreak first was reported in China in January, no country in Africa could be able to do laboratory diagnosis. By the time we were seeing the first case in February, only 2 countries could be able to do laboratory diagnosis. So Africa CDC immediately went into capacity building mode. So in February, there were only 2 countries that could be able to do laboratory diagnosis. And we immediately went into capacity building mode. And we have built capacity of member states across the continent. And as we speak today, 43 countries and over 100 labs can be able to do laboratory diagnosis in Africa. The others who do not yet have the full capacity, we have put into place a system where they can be able to use resources in a neighboring country. That way, laboratory testing is still something that takes a maximum of 24 hours. We should be able to have results. And if it is within the same country, 12 or so hours, we should be able to have results. So this is a laboratory diagnosis as one of the pillars. The second pillar is enhanced surveillance, particularly in the beginning of this outbreak, because the disease was outside of Africa. We built the capacity of member states to be able to have staff at their points of entry, particularly airports, and with the appropriate gadgets, thermoscanners and things like that, so they could be able to pick individuals who were showing signs and symptoms of probably having the disease. And in this way, we were able to pick out quite a number of suspected cases. And this enhanced surveillance has now moved on to hospitals and other health facilities, where we are training our health workers to be able to identify who may be able to have those signs, so that they can be able to be secured and not transmit within the community. So the second pillar is enhanced surveillance. The third pillar is infection prevention and control. This is where we provide the appropriate tools and knowledge to our health workers so that they are protecting themselves, because they are really the true frontline workers. And because we have very few health workers in Africa, they are a very rare resource, they are a very precious resource, we must protect them. So we are providing capacity building, and we are also providing the appropriate tools like protective equipment, masks and shields, things like these, so that our health workers can be able to do their job without too much worry that they will get infected, because they are few and we must protect them. The fourth pillar is clinical management. For those relatively few patients who will need critical care, we are building the capacity of our clinicians of all cadres, so they're able to tackle management in an efficient way, and so that we can be able to avoid the large volume of deaths that we are seeing in other parts of the world. The fifth pillar is risk communication. Most of us will have seen a lot of rumors flying around, misinformation being shared, particularly on social media. And we are tracking these rumors, we are tracking this misinformation, and we are using them to be able to design messages that are truthful, that are correct, and can then be able to protect members of the public. So we've been building capacity across the continent in risk communication, so that ministries that are responsible for communicating with the public provide information in a timely manner, in a regular manner, and information in a way that is adapted to the local communities, whichever country we are talking about. The sixth pillar is supply chain management. The products that we need, the health supplies, the medical supplies that we need to be able to tackle this outbreak, we have seen that were largely being manufactured in China. And when China went into lockdown, the supply chain was severely disrupted, and getting these materials has become quite difficult. So what we are doing as Africa CDC is through market intelligence, knowing who is producing what, we negotiate for bulk buying, we bring it into Africa, and then we distribute it to the countries as they may be able to need. And so supply chain management is a very important part of our response. Now, this particular condition is different from many of the outbreaks that we've been handling in Africa. Some of the most memorable ones like Ebola or Lassa fever, indeed cholera, they do not affect all countries at the same time. COVID-19 is affecting all countries at the same time. This means that the resources that are required are huge, and every country, irrespective of their level of wealth, whether they are in Africa or outside, every country has its own challenges of trying to control the disease within their borders. This has translated into the key need for members of the public to be deeply involved in ensuring that we break the transmission. And this is where civil society becomes extremely crucial in the measures that have been put in place. Every individual is responsible for contributing to the reduction in transmission, indeed in breaking the transmission where appropriate. And civil society are very key in this particular area of ensuring that members of the public are actually participating fully through good discipline, which is based on good information and the desire to protect not just the self, but also the community at large. Now, the continental joint strategy that I've given the pillars for has been endorsed by the heads of state. The Bureau of the Heads of State of the Africa Union has been meeting since for the last 3 weeks, and they meet regularly on a weekly basis. They have endorsed the strategy, and out of the strategy, we now have an Africa task force for coronavirus. The task force is led by Africa CDC, and its membership is across the 55 member states. And those 6 pillars I talked about form the base of the technical working groups that feed into the task force. Now, the task force role is to be able to ensure that there's coordination at the continental level, and that there is also coordination within the different sectors. Now, let me shift a bit to the issue around resource mobilization. The kind of resources that we need to be able to tackle COVID-19 is huge. And the resources are required both at the financial level, the technical level, the human resource level. Indeed, the basics of society have completely been disrupted. And right now, getting resources from one place to the other has become very difficult. For example, as Africa CDC, we have experts that we need to move from one country to the other. There's no more air transport. Many of the countries have closed off their borders. So in this way, we use humanitarian corridors, and we are in agreement with countries that whenever we need to move staff or commodities, then we seek special permission, and we are able to move our experts and our commodities to be able to help those countries. So the resources required are very broad, because this particular outbreak affects literally everybody. So long as there is exposure, it affects literally everybody. Nobody is spared. Now, in terms of resource mobilization, what the heads of states have put in place is a COVID-19 response fund. And this was established about 2 weeks ago, where member states and friends of Africa are actually contributing, and those resources are used in Africa CDC's and Africa Union's response to COVID-19. And that is at the high level in as far as resources are concerned. At the medium level is what we are doing with partners. Using the joint strategy, we are seeking out friends, we are seeking out partners to be able to secure enough resources to address each of those 6 pillars that I had talked about. And so far, we have been doing quite well in as far as mobilizing resources is concerned, and the resources are being used to support member states in their national level activities. Having said that, it is very critical and important for the public to be involved in resource mobilization. And when I say resource mobilization, I don't mean money. Just knowledge of what needs to be done is a huge resource, because it can be able to secure a community from getting transmission coming into that particular community. So the resources we are talking about are knowledge. The correct knowledge is very important. The resources we are talking about are sheer numbers of human beings who are participating in providing information and services to the public. The resources we are talking about are our health workers, them being protected so that they can be able to do this difficult work of looking after those who are unwell. The resources we are talking about is technical know-how. Our experts developing guidance and guidelines and tools that we can then be able to use in the fight against COVID-19. The resources we are talking about is tangible, non-financial resources like making available transportation, making available sanitizers, making available drums and taps where water can be able to be used for washing hands, making available soap. Very tangible, non-financial resources. And of course, at the end of the day, we are also seeking financial resources to be able to cover some of the costs. Let me just touch on 2 challenges that we see before I end my presentation. One very big challenge is testing. And testing is a challenge because the test kits that are required and are specific for this particular virus are not being made by very many companies. Because it is a new virus, few companies are actually making them. So getting access to these test kits has become a very big challenge, particularly in Africa, because we do not have any manufacturing company here that does it on a large scale. A few laboratories are doing their own test kits, but those are in a very small scale at laboratory level. But at a big scale, which can be able to be used for expanding testing of citizens, that is still a big challenge. So if we test people, then we know who is exposed, and using their contacts, we can be able to contain the spread of the virus in the community. So that is one thing that is a big challenge, getting test kits into Africa. The second big challenge that we are facing are commodities. These are gowns, these are protective equipment, these are gloves, these are masks, these are shields, these are goggles, including medication that we need for patients who have been hospitalized. These have become difficult to come by because they're being manufactured only by a few people now, and many countries are demanding the same. And we as Africa CDC, Africa Union, we are trying to secure as much as we can, and then we distribute. So these two very key challenges, I would say, have slowed down our response, although the quantities that we are securing now and distributing to the member states have been able to sustain the testing and have been able to sustain our health workers to be able to do the job, which is very difficult of looking after COVID-19 patients. And finally, civil society. Civil society is really the engine of success of this COVID-19 outbreak. If civil society get properly involved in communicating with the public, in securing the different types of resources I've talked about at country level, of securing containing the spread of the disease away from those who are vulnerable, raising and mobilizing resources, particularly around food and water, so that communities can be able to observe social distancing, can be able to go through the lockdowns without too much pain. This is a job that the government will not be able to do on its own. This is a task that as at Africa Union, Africa CDC, we will not be able to do, but civil society being everywhere on the continent, they should, they can, indeed, in my view, they must do, because this is the time where everybody's action has an impact. And when that action is positive, then the impact is also going to be positive. If that action is negative, like the rumors that we see around and the theories that are being thrown around, if the action is negative, then the result is going to be negative, and the suffering amongst the community is going to be even more. Therefore, I would like to call upon us as individuals, groupings of civil society, and those of us who are working in the technical area to come together. And at Africa CDC, we are saying the strength of Africa will come out of the way we cooperate, the way we collaborate, the way we coordinate, and the way that we communicate. These 4 C's are the ones that are going to ensure that we eventually have success in controlling COVID-19, flattening this curve so that we are able to have numbers we can manage, and we are able to limit the harm that COVID-19 will bring onto the continent. I thank you.
And we thank you very much, Dr. Ouma. I mean, this is, I think, a very important opportunity for all of us in civil society to hear directly from the Africa CDC, which is at the forefront of this fight. And I think we remain for even more motivated to really enhance the cooperation that we have begun. Indeed, there's a number of questions that have already started that have started coming in, but I just wanted to touch briefly before we go to Dr. Chehbouni on the issue of misinformation, which is really one of the big structural obstacles we need to overcome. We actually, as ECOSOC, have reached out to the Africa CDC recently, and I'm hopeful that you will see this communication where we are proposing that we collaborate with you to institutionally develop some messaging to combat the wild myths and claims and all kinds of misinformation that is circulating around. So I think this is something that we want to reinforce our readiness to work with you on. Before I open the floor to the questions that have started flowing in, I would like to invite our second speaker, also another Dr. Ahmed. Today's presentation is presented to you by Dr. Ahmed. So the second Dr. Ahmed, Dr. Ahmed Chehbouni, is from civil society himself, and he will be speaking to us about his experiences in Morocco, Marrakech to be specific. So Dr. Chehbouni, you have the floor, sir.
Yes. Do you hear me?
Yes, we can hear you.
I want to speak in French, okay? No problem?
Yes, please go ahead. You can speak in French.
Okay.
Because we have it.
Donc, moi, je vais parler, le premier intervenant a parlé d'une façon globale sur tout le continent. Moi, je vais parler surtout de l'expérience marocaine, si vous permettez, car là où j'ai agi beaucoup. Donc, notre gouvernement a pris dès le début les bonnes initiatives. Il a fermé les frontières, car nos voisins, en voyant ce qui se passe chez nos voisins européens, il a fermé les frontières. Après, il a décrété le confinement et il a fermé même les circulations entre les villes. Donc, mais le problème auquel il s'est affronté, que les gens, les pauvres qui vivent le jour, n'ont pas les moyens de rester chez eux. Ils ont besoin de ça. Qu'est-ce qu'il a fait le gouvernement ? Il a décrété un fonds de solidarité. Mais le temps que ce fonds, que l'argent se regroupe, que l'administration, les finances et tout ça, il a fallu 15 jours. Donc, c'est la société civile qui a pris l'initiative, car il est très souple. Nous avons ouvert des comptes et nous avons demandé la générosité de nos membres, des bonnes volontés. Et dans 2 jours, on a pu commencer le travail, c'est-à-dire avec les autorités. On a le réseau associatif dans les villages lointains et tout ça. Ils nous envoient les listes et nous, avec des grossistes, la marchandise va, les paniers de première nécessité selon cette liste et avec les autorités, car le rôle des autorités est très important ici, parce que si on arrive, les gens vont se rassembler et donc c'est pas sanitaire. Donc on fera porte à porte les autorités, la collaboration entre les ONG et l'autorité. Donc les associations ont joué un rôle surtout comment dirais-je, très rapide. Ils n'ont pas besoin de toutes ces structures, des réunions, des décisions, etc. Ils connaissent la population, ils connaissent les pauvres. Donc, et on a fait comme ça pour chaque douar dans la région. Et le fond, il y avait un élan très, très important de solidarité. C'était la première fois où je vois une collaboration vraiment étroite entre les pouvoirs publics et la société civile en attendant que l'État arrive à subvenir aux gens qui sont dans la misère. Le deuxième rôle qu'a joué la société civile, c'est la sensibilisation. Les gens, car il y a beaucoup d'abord, les gens ne sont pas disciplinés, surtout les quartiers populaires. Encore, il y a le problème religieux. Les gens disent que si on veut mourir, c'est Dieu, que c'est notre destinée. Donc, ils ne prennent pas ça au sérieux. Les classes moyennes, c'est OK, mais les quartiers populaires, il y avait des problèmes. L'État a été obligé de décréter la prison pour ceux qui ne respectent pas le confinement. Il faut maintenant une autorisation spéciale pour chaque maison et une seule personne qui va faire les achats dans l'épicier le plus proche. Il n'a pas le droit d'aller loin de son quartier. Donc, l'État a fait beaucoup d'efforts. Nous avons des problèmes pour les masques, bien que l'État a obligé des manufactures de tissus de fabriquer ces masques, mais jusqu'à maintenant, il y a encore un manque. Il y a aussi un manque d'appareils respiratoires, un manque terrible, car bien que le Maroc, comment dirais-je, malgré ses décisions, mais on ne fait pas beaucoup de tests si on compare avec l'Allemagne ou l'Italie ou la France. Les tests sont limités dus aux moyens. Il y a un autre problème qu'on a proposé, c'est-à-dire on ne peut pas recevoir tout le monde dans les hôpitaux. La capacité est limitée. Donc, on propose que les gens qui ont des maisons assez grandes, qu'ils restent chez eux, même s'ils sont contaminés, mais ils restent isolés et l'infirmière ou le médecin vient les voir. Parce qu'on n'a pas la capacité de ça. On a proposé ça. Donc, voilà ce que je peux dire encore. Il y a une coordination maintenant entre le Maroc et quelques pays africains, surtout le Sénégal. Il y a des échanges d'expériences. Le Maroc a contacté plusieurs pays voisins, surtout l'Afrique du Nord et le Sénégal et d'autres pays, je crois Côte d'Ivoire aussi, pour échanger. Hein? La Côte d'Ivoire et surtout le Sénégal, ils ont échangé, ils veulent coordonner leurs efforts, car comme a dit votre interlocuteur, c'est la première fois où cette pandémie est générale et aucun pays n'est épargné. Donc voilà, comme je dis, la réussite, je le dis bien, c'est la société civile et la coordination avec les autorités. Les deux, ils ont joué un rôle, et la générosité des gens. Car c'est le moment où jamais, si on ne donne pas maintenant devant cette crise où la vie est menacée, quand est-ce qu'on va donner? Donc, et surtout les ONG crédibles, car les gens envoient et font des virements directs. Ils ne se déplacent pas, la majorité ne se sont pas déplacés. On a des applications juste par ordinateur et on fait le virement de notre compte au compte. En plus, l'État avait demandé 13 milliards de dirhams pour ce fonds. Il a dépassé, il a presque doublé. Il y a une générosité, c'est très bien, le secteur privé. Et il y a aussi il y a beaucoup de salariés qui ont proposé un mois de salaire et l'État, le Premier ministre, avait décrété 3 jours de salaire pour tout le monde, qu'ils veulent tous les salariés du Maroc, pour subvenir à cette catastrophe. Donc on découvre surtout ce qu'ils sont les atouts de la société civile et sa contribution aux côtés de l'État. Les atouts, premièrement, sa flexibilité, sa rapidité et sa connaissance du terrain. Ça, ils étaient vraiment, car si les populations doivent attendre 15 jours pour la mise en œuvre du programme gouvernemental, la catastrophe aurait été plus grave. Donc voilà, la société civile, il est proche du terrain, il connaît les gens qui sont dans le besoin et on a fait un beau travail et ça continue. Et ça continue car on ne sait pas quand est-ce que, normalement ils ont dit le 20, mais je ne crois pas, ils vont prolonger ça car chaque jour il y a des tests juste hier, il y avait 60 militaires dans une caserne à côté de Marrakech qui étaient tous contaminés. Donc il y a encore le risque et on peut s'attendre à qu'ils prolongent. Je suis sûr qu'ils vont prolonger le confinement et donc il faut que la mobilisation continue. Et ce que je dis maintenant, on propose ça aussi au gouvernement, que cet élan d'aide et de solidarité doit rester au-delà de cette crise. Car nos problèmes viennent de cette pauvreté, comment dirais-je, sévère que vivent au moins le tiers de la population. Donc cet élan de solidarité doit subvenir car on le voit maintenant, le confinement se passe bien chez les personnes moyennes, chez les riches, c'est tout ça, mais chez les pauvres, il y a un problème. Donc si on avait une solidarité sociale, si on avait un tissu, comment dirais-je, crédible, la crise va être, et si on était plus discipliné, car même, regardez, même aux États-Unis, et on était plus discipliné, la crise passera avec le moindre dégât. Donc voilà en gros je suis prêt à répondre à vos questions. Voilà en gros ce qu'on a. Donc il y a la sensibilisation, le problème culturel, la religion aussi, elle a joué un mauvais rôle. Car il y a même des gens qui incitaient, il y avait un imam qui incitait les gens d'aller faire la prière aux mosquées. Et il a été condamné à 1 an de prison. Voilà ce que j'ai à dire. Donc, la société civile a joué un bon rôle. Merci.
OK. Merci beaucoup, Dr. Chehbouni, de nous avoir parlé du rôle très important de la société civile dans la bataille à laquelle nous sommes confrontés pendant cette pandémie. Je pense que votre contribution renforce en fait les propos du docteur Ahmed Ouma par rapport au rôle très, très critique de la société civile dans cette période. So we will now open up the floor for questions. Looking at the time that we have, which is not a lot, so what I'm doing is I'm trying to group some of the questions into general buckets, which I will ask our presenters to address. If I might take the privilege of the moderator and start with a question on my behalf, on behalf of ECOSOC and on behalf of the co-organizing team as well with African Development Bank, Dr. Ouma, you have spoken really quite clearly on the role of civil society and the fact that everybody has a role to play. So for those of us that are engaged directly on a day-to-day basis as institutions dealing with civil society, and here I'm talking about ECOSOC and also the AFDB's division responsible for civil society, what would you like to see institutionally from partners like ECOSOC and from the AFDB civil society division? How do you think we can best optimize our cooperation with you in order to bring as much impact as possible to the work that the Africa CDC is leading?
Thank you, Sid. That's a loaded question. From Africa CDC's perspective, if we can be able to have a coordination amongst the civil society, this will be a huge help in ensuring that the strategy is actually getting implemented at country level. Civil society, by and large, are the watchdogs for members of the public. And if civil society are organized enough at country level so that the voice of civil society is very clear and united, you can be able to get clear messages to the public. You can be able to get clear messages to the government so that whatever resources are being set aside are being utilized directly for COVID-19 response. So one is coordination at country level. Second is resource mobilization. Many times we only think about funding, but this is the time that civil society organizations need to come together and start seeking expertise, start seeking contributions in kind, start seeking resources beyond funds, putting together the knowledge that has been built over time in tackling other areas of our socioeconomic fabric. If we tackle other areas and we bring the experience of tackling other areas into COVID-19, and we are able to seek resources beyond funds, then I think we can be able to go much further. Because getting money when the economy is not so bubbly is difficult. But getting a carpenter to produce something using their expertise, getting a communication expert to be able to provide pro bono services, getting different professions and experts to provide this kind of knowledge and skill at the disposal of COVID-19 response will go a long way in ensuring that we are not only stopping the spread of this virus, but we are also bringing unity and solidarity amongst the population. These are two key things that I would encourage civil society to do so that their impact is felt directly by the people. Thank you.
Thank you, Dr. Ouma. And if I might just come back to you, because you had touched on something which is of interest according to the question that we are receiving. I'm going to lump some of them together, but quite relative to the answer you just gave in terms of mobilizing resources technically from wherever we can find them. We have some interest from medical professionals in the African diaspora. And so there has been some questions to this effect. If there are any plans to source or to mobilize medical expertise from the African diaspora overseas, that's one. And then two, we also have, again, multiple comments that are talking about homegrown solutions I'm not a doctor, so I cannot really ascertain the efficacy of these solutions, but we have quite a number of comments along these lines. One of them is in telemedicine. Others are in public health in terms of communication and so on. So there's a lot of interest to see what the Africa CDC might have in terms of supporting possible or potential homegrown solutions from Africa as well. So maybe you can address those two for us as well.
Yeah, thanks. On the issue of medical experts in the diaspora, I think the resource that is the diaspora is huge. Their kind of skills and experience that they have gathered when they're outside of their home countries, outside of the continent, is very valuable during this time. And the immediate way that they can be able to put this into use is providing their knowledge and service using technology. They can be able to be supporting our colleagues back here on the continent with the research piece, making things easily available for the frontline worker. So the frontline worker doesn't have to go and check what kind of therapies are being tested. The diaspora colleagues can already have done that. Reduce it into a practical message that then can be able to be transmitted to those who are in the front line in Africa. This is one way of doing it. The second way of doing it is to mobilize through their own networks out there. They can be able to mobilize different types of support specifically for their medical colleagues back home, so that many of these things that we are struggling to get, medical supplies and different types of therapies that may be difficult to get because of the supply chain interruption, can be able to be made more easily available back in Africa. The third way they can be able to do that is offer themselves to be part of our think tank at Africa CDC, because this is a public health issue and we are stretched. Our public health colleagues, our clinical colleagues are very busy on the front lines. And if our colleagues in the diaspora may have an hour or two in a day, they can be able to donate to be our think tank. This would be very useful. Then we can be able to utilize their knowledge, their skills, their education, and their willingness to participate in supporting African interventions. The second question around homegrown solutions. First, let me say that at Africa CDC, we encourage innovation. And innovation is easiest when you're using materials and tools that are nearest to you. That way, you can actually be able to make progress rather than do nothing. So innovation, we really encourage. And when something has been seen to be making a positive impact on COVID-19 intervention in whichever way, whether it is socially or medically, it is important to share that so that we can be able to put it through a little bit of testing and be sure that it is something that is reproducible, it is repeatable, and therefore can be confirmed that it can be able to work. And allow me at this stage to also touch a bit about the controversy around vaccine testing and therapy testing in Africa. We at Africa CDC and in collaboration with the WHO, we have a very strict mechanism which is global standard in ensuring that any clinical trials being done in Africa are ethical and they follow the gold standards that have been set for clinical trials. Any vaccine that is being tried in Africa, they should follow the same path. And we have enough professionals who can be able to guide this work in Africa. So in similar fashion, any homegrown solution that has been seen to be able to work, let us put it through the test, refine it, and then provide it as a solution, not only to Africa, but to the world. We encourage innovation. Thank you.
Okay, and a couple of clinical questions since we have you. Again, it can also help in terms of disseminating the right information, the verified information that the Africa CDC wants us to disseminate. One of them is looking at the fact that we have relatively low numbers compared to some other regions of the world. So I guess the question is, do we really see this pandemic as something that is a grave threat compared to some of the existing threats that we already have, such as malaria, tuberculosis, and so on? Is it something that we really need to be extending this amount of effort and resources upon? I think it'd be good for us to hear from you to address those that might have these kinds of questions. And then secondly, it's a clinical question, looking at the fact that there's a lot of asymptomatic cases around. Do you or does the Africa CDC recommend that people wear masks or facial coverings as a matter of course, just to potentially protect against any asymptomatic cases?
Thank you for that. The first question is one that needs to be taken very seriously, because it can be able to lead us to make decisions that may be very painful later on in the month or so to come. Let's look at the virus itself. It is probably the most easily transmissible virus known to man. And combined with its rate of its fatality rate, we have a case fatality rate now that is above 4%. This is higher than any other virus that is easily spread through sneezing, coughing, touching objects, etc. Other viruses that are really high in as far as the case fatality rate is concerned are not easy to spread, like Ebola. It's not easy to spread, but this one is very easy to spread. And when we look at the group of viruses that are easy to spread, this is probably the most deadly. It means that we must take it seriously before it becomes a crisis. That is my first point. The second point is that numbers are very, very deceptive. Let me take an example of the US. At the beginning of March, they had about 10, 20 cases. A week later, they were in a few hundreds. Today, they are in hundreds of thousands, and it is barely 4 weeks down the line. It means that this virus is quietly spread. When you don't take it seriously, it will quietly spread in the community, and then it will burst open when it hits the vulnerable in society. And the vulnerable in society may be a bit different in Africa when you compare to Europe and the US, but still, there will be many lives that will be put at risk if we don't take it seriously. This does not mean that we stop addressing our usual problems in healthcare: malaria, TB, HIV, cholera, all the types of illnesses that affect our children. We must continue with those, because if we stop addressing those ones, then we are going to have deaths and suffering coming from another set of diseases. So we at Africa CDC are encouraging governments that your health systems must still be in place to address all the other health conditions that a country usually has, while increasing the index of suspicion for COVID-19. So it should not stop. The investment should continue, and the services should also be able to continue. But do not let the low numbers deceive you, because when it bursts in large numbers. And we don't want that to happen, because it will overwhelm our health systems, and we want to keep the numbers low. The second question on use of face masks. The way that this virus spreads is through droplets. There is no evidence that it spreads through the air, in the sense that the actual virus will float. If the droplet is very small, it may float for a little while, but it doesn't go too far. So social distancing solves a lot of the problems that will come from droplets, from one person to the next. When you are unable to keep that social distance for purposes of work, or purposes of travel, or purposes, whichever purpose will require you to be too close to another individual for a long period of time, which is a long period for us, we say it is more than 15 minutes. If I'm going to be in a situation where I have to stand next to someone else for more than 15 minutes, I want to wear a mask. That way, if the person is talking or sneezing or coughing, I am protected. Now, wearing a mask and wearing a mask properly are two different things. Wearing a good mask and wearing a bad mask are also two different things. So although we do recommend and encourage that when you are near another individual for an extended period of time of more than 15 minutes, you want to wear a mask, we are also insisting that the mask must be worn correctly so that it acts as a proper seal around your mouth and your nose. When you wear a mask and it is on your neck or on your forehead, it doesn't help. It needs to cover your mouth and it needs to cover your nose. But the circumstances that require the wearing of a mask are very clear, and we have communicated that. It is when you're in close contact with somebody. Now, let me add that the type of mask that the members of the public will wear is different from the type of mask that we reserve for health workers. Do not wear the N95 mask, for example, because you are not a health worker. And when the members of the public wear masks like these, they take away a very important resource from the health worker, and therefore exposing the health worker to shortages and exposing the health worker to the virus. So members of the public should wear the normal masks, but they should wear them properly. And it is encouraged that you wear the mask when you know that you're going to be in close contact. For example, you've gone out to the supermarket and there are a relatively number of people. When you're going to be in close contact of less than 1 meter with anyone for periods of more than 15 minutes, you wear a mask. But if you're doing proper social distancing, then you don't need the mask. And that is why when we encourage people to stay home, then you don't need to wear a mask when you're at home. But then when you come out, you need to wear it. The vast majority of people who are getting infected because they are touching an object which has been infected by the virus, and then you touch your nose, mouth, or eye. That's where the majority of the infections are coming from. So as we talk about the masks, we must realize that the majority of the infections are coming from us touching the wrong surfaces. That's why we say, wash your hands as soon as you're able. Wash your hands before you touch your face. Wash your hands before you touch an object that someone else is likely to touch. So we need to be aware that breaking this transmission is going to come from a multiple of actions and not just the one around the mask. Thank you.
Okay. Thank you very much, Dr. Ouma. I have quite a number of questions from CSOs that touch on the accessibility of funding and the availability of potential funding sources. A lot of our participants are speaking about what they are doing and how they would like to either scale up or expand, and what are the potential facilities that they might be able to access. And for this, we would like to lump all of these questions into one and invite our colleagues from the African Development Bank who can speak to us about any potential opportunities in this area, maybe what the bank might be interested in doing in this area, so that it will answer this question kind of once and for all. And for this, I'm pleased to invite Mr. Luther Yamiogo, who is our interlocutor from the AFDB. Luther, you have the floor.
Okay, thank you. Thank you very much, Nana. Can you hear me?
Yes, we can hear you fine, yes.
Ok, au nom de la division Société civile et engagement communautaire de la banque, je vais répondre de manière groupée à une série de questions. Je vais d'abord commencer en anglais. Yes, coronavirus has triggered a funding crisis for CSOs and NGOs when they are needed most. And yet, the international humanitarian and development sector is itself rapidly facing a critical threat from this pandemic due to funding constraints at the precise moment where CSOs' work has become vitally important. Leaving CSOs aside now would be catastrophic to CSOs' ability to respond to both the immediate and long-term crisis forward. Potential solutions might include, first, an anticipatory internal funding mechanism to make finance raised within the organizations to address immediate needs and to evolve and adapt as those needs and contexts change. CSOs which have capacity shall reorganize their annual budgets to prioritize emergency. Some of those organizations have contingency plans and they can activate. This appears as a prospect of dialogue with respective donors and for synergies with other CSOs. Most of you are already doing this, and Dr. Ahmed brilliantly mentioned the related resources beyond money, which are capacities, which are enabling environments, and which relate to knowledge or logistics. Another solution is, at the bank level, establishing a COVID-19 response investment vehicle like we are doing currently. As you are aware of, the bank has already contributed to the World Health Organization global response, and the bank has also adopted last week a COVID-19 response facility to assist its regional member countries in fighting the pandemic. This facility is the latest measure taken by the bank to respond to the pandemic and will be the institution's primary channel for its effort to address the crisis. CSOs will plug into existing response mechanisms where appropriate to ensure an efficient and all-inclusive national response. We also have the corporate social responsibility mechanism within the bank, and some country offices are identifying reliable organizations to support with social protection, food distribution, wash, meaning water, hygiene and sanitation, sensitization and communication, like fighting misinformation and fake news. Please link up with the bank's country offices and share, if you have some, relevant proposals to our civil society efdb.email address as well. We'll have these country offices as entry points with possible support for the CSOs and NGOs to leverage the national responses with required capacity. We are also preparing, in partnership with the Islamic Development Bank, a grant for CSOs which shall operate through a call for proposal. From these webinars, we have the occasion to integrate you, CSOs, in our data, and we'll come back to you accordingly. The bank sees here an opportunity to design and develop new financing solutions which could help to find new and better ways to tackle global challenges together. These have never been more needed than now, and this is why our division has accelerated the process of developing a civil society trust fund to support consistently African CSOs building on COVID-19 to revamp a new civil society engagement model. Let's move together from this emergency response to shaping a more inclusive future. I also have my colleagues, our manager Zeneb, they are by and can come back if you have further related to the mechanism and instruments. Thank you very much, Nana.
Thank you very much. So we will then go straight to Madame Zeneb then, if she would like to add anything.
Good afternoon, everybody. Good afternoon, Nana and colleagues. To Ahmed for your brilliant intervention. Thank you very much, Luther, for the well-developed response on what we are doing. And Luther is the person in charge of it, and I think he presents very well what we are doing just now regarding our response to the COVID and in supporting civil society organization for our response to fight the COVID crisis, but also what we are intending to develop in the future. This trust fund, it's a huge call from civil society organization to develop, to have a direct financing mechanism for them. And this, I think this time is the momentum also to work on it. We are working on it and we'll come back to them for that. I don't want to take more. Today, it was not planned. C'était pas prévu que je parle, mais bon. Luther, je te renvoie la parole. But I'm here, I'm hearing you. I heard a very good points from the two interventions, I think we will come back to them later to see how we can engage with them.
Yes, yes, I agree. I agree with you, Madam Toure. I think Luther has provided really what a lot of our participants were hoping to receive in terms of information. So I think that has more or less answered that particular section of the comments. What we will do is to encourage, as Luther has access to encourage participants to liaise with the banks branches within their individual member states to understand more about this and see what opportunities might be available to them as individual CSOs. So I think this is already good guidance for them, and I think this is something that they can take away from here, from this conversation. We are running a little bit behind time, but I want to give Dr. Chehbouni the opportunity to maybe wrap us up. Dr. Chehbouni, there's a few questions also that I think will be interesting for you to address in terms of civil society. These questions touch on, the intersection between wanting to respect the lockdowns that our governments have put in place, but also with the need to respect human rights and make sure that there are no violations. So what would you say to this particular conflict, where sometimes you have potential violations of human rights by forces that are implementing the lockdowns in our respective countries? And can you also speak briefly to the gender aspect of the lockdowns? We've seen data about how gender-based violence and domestic violence is really increasing as part of the lockdown.
Oui, donc juste, je vais, pour les questions, oui, la femme, il y a une augmentation de la violence domestique, ça c'est un fait, même au Maroc, malheureusement partout dans le monde, puisqu'ils sont les premières victimes. Donc nous, en tant qu'association, nous avons ciblé les veuves, les dames, les femmes pauvres. Nous avons fait, en particulier, nous avons aidé les femmes pauvres. Il y a une deuxième chose, pour les ONG qui sont crédibles, nous sommes juste 2 ONG, c'est dans la région de Marrakech, et à nous 2, nous avons collecté plus de $100,000 américains. Des gens, donc, s'ils voient la crédibilité et la traçabilité, la bonne gouvernance, et chaque fois, on leur envoie la liste des gens qui ont été bénéficiaires, les sommes qui sont rentrées, les factures et tout ça. Donc, les gens, quand ils voient que c'est clair, que c'est transparent, ils donnent. Ça, une première. La deuxième chose qu'a révélé cette pandémie, que le rôle de l'État et le rôle de 2 piliers. Les 2 piliers, c'est la formation, l'éducation et la santé. Ça, toutes les recommandations qui disent laisser ça au privé, non. Maintenant, ça a montré cette expérience qu'un État fort, avec ces 2 piliers, il n'y aura pas de problème. L'État aussi a invité, ça je n'ai pas dit tout à l'heure, il a invité tous les religieux éclairés à passer à la télé et à sensibiliser les gens qu'ils peuvent faire la prière chez eux, qu'ils n'ont pas besoin de se rassembler, le bon Dieu les écoute. Donc ça aussi, c'est une bonne chose. Autre chose aussi qui pose un problème et que l'UNICEF a fait un communiqué, c'est que les enfants qui sont contaminés, les jeunes, ils passent 12 heures devant l'écran. Et ça, c'est grave. Donc, il faut aussi protéger nos enfants à la maison, mais la part des choses, un peu de sport, un peu de lecture, et ne les laissez pas en ligne devant les écrans tous les jours. Qu'est-ce que je peux dire encore? Je peux dire aussi que la leçon tirée, que la pauvreté absolue est un facteur, la pauvreté absolue est un facteur de l'expansion de la pandémie. Donc, pour la meilleure protection aussi parmi la meilleure protection, c'est réduire la pauvreté. Donc, s'il y avait moins de pauvres, il y aura moins de contaminés. S'il y avait moins d'analphabètes, il y aura moins de contaminés. Donc, ça aussi, c'est... Il y a une autre chose qu'on a constaté. Il y a des artistes, car le problème pour acheminer dans ce temps de confinement, il y a la mobilisation des fonds et il y a la logistique pour transmettre, pour l'achat et transmettre le produit aux destinés, surtout que les gens ne peuvent pas se rassembler, se regrouper. Donc, il y a des artistes marocains qui ont fait un appel à la collecte des fonds et ces artistes, en collaboration avec des ONG, ils ont pu leur donner l'argent des petites ONG dans les quartiers pauvres et ils ont acheminé cette matière première de première nécessité aux gens. Donc voilà, on retrouve, comme j'ai dit, un État fort qui nous protège, ça c'est son rôle surtout dans cette période. Quant au droit, quant à la relation entre les droits de l'homme et l'état d'exigence, je crois, je suis un ardent défenseur des droits de l'homme, mais dans ces conditions, le droit à la vie prime, sans pour autant toucher. Regardez par exemple les Américains, les Italiens, le bon vivant. Au Maroc, c'était tout le monde rentre, sinon la prison, et ça a été payant. Sinon, je ne sais pas comment on saurait. Aussi, ils ont imposé à des entreprises qui formaient des tissus de se transformer pour former des casques, des masques. Ça, c'est aussi... Donc, il y a les droits de l'homme, mais il y a le droit de la vie. Et je crois, c'est dans de la collectivité et non pas de l'intérêt de quelques personnes. Il faut, dans ces temps de guerre, ces temps de panique, il faut, comment dirais-je, avantager le droit à la vie. Donc, il y a eu des décisions du gouvernement comme couper le salaire sans consultation des fonctionnaires, donner 3 jours de salaire, c'est une bonne chose. Même si on ne me consulte pas parce que je sais qu'il va dans le bon sens pour protéger, pour subvenir aux besoins, pour nous protéger tous. Voilà, donc cette relation, il faut la pondérer entre les droits de l'homme et le droit à la vie.
Thank you. It's a very important distinction to make, Dr. Chehbouni, and thank you for highlighting that. We have passed the time that we were designated. So if you allow me, I would like to wrap up this session by making just 1 or 2 comments to bring everything together, to tie together the presentations, the questions, the discussion that we've had today. I think one thing that I would like to bring out is that at the Africa CDC, who are the people, the institution really at the forefront in the trenches fighting this battle, they have been quite clear today in terms of what they want to see from civil society. So Dr. Ouma, for instance, has talked about how can civil society mobilize resources, not just financial, but technical and other resources. How can civil society support the implementation of the confinement or lockdown measures by maybe mobilizing and then distributing basic supplies such as food and water to people so that they don't have to leave their communities and then get exposed. So these are some very, very specific things that the Africa CDC has talked to us about what civil society can do. On the other hand, the African Development Bank has talked to us about the potential for financing civil society if they are able to develop the appropriate interventions, the appropriate proposals. So I would suggest that it will be an appropriate proposal to design a piece of work that takes into consideration what the Africa CDC is asking from civil society. So these are the two main components that we need to bring together. So if your project can marry the resources of the AFDB with the requirements of the Africa CDC then in my view, I think, you have a good proposal. So I think these are some things that we can begin to think about as civil society. The second thing that I would like to mention is to Africa CDC, Dr. Ouma. Again, I would like to reiterate our readiness to support and to work with you. I think that we see that our value is amplifying the voice of the CDC within the civil society. We are not producing content, we are not generating guidance of our own. We just want to take what you are producing and generating and make sure that as many of our people have access to that as possible. And so we want to signal our readiness to continue to build on this interaction beyond this webinar. Again, we thank CDC for the availability. We've already been engaging with the CDC on different things. We have indicated our readiness to produce some multimedia content around the false claims, the misinformation, and the myths. So that's something we can do together. And also, even if you think that it would be helpful for us to have a liaison person within the Africa CDC who can work with us on an ongoing basis to bring what you're doing to the civil society, that's another thing that, again, we are ready to support. So again, this is something that we can take away from this seminar. So again, I would like to take this opportunity to thank you very much, Dr. Ouma, for taking time out of your very busy schedule to speak to us. And also, again, to reinforce our gratitude to Dr. Chehbouni for really sharing the experiences of his organization in Morocco and for giving us lessons learned and advice for all of us who have been here on the webinar. For the questions that we've not been able to address, we will take them together and make our best efforts to secure additional information to all of you, since we have your registration information. So with this, I would like to thank you very much for being here, and we look forward to meeting you next week, Friday. Please continue to spread the message about the work of the Africa CDC. Share information about this webinar through your contacts, because this is the way that we can really link the CDC to the people of Africa. So if you are active on social media, please make sure to really disseminate information about this webinar, about ECOSOC, about the CDC, about the African Development Bank. So with that said, thank you so much, and see you next week.